Welcome to another Vulval Pain Society social media live. Thank you, as always, for joining us live, or if you're watching the replay. Now, if you are live, please say hello in the comments so that I know that you can hear and see me okay, and you can comment as we go along too. So whether you're on Facebook or you're on YouTube, just say a hello in the comments so I know that you can hear me. Hello. Hello. Hi, Sally. Thank you. Okay, I'm assuming you can hear me fine. And I can see there's 12 people already joined. And as people slowly join, I'll introduce myself if you don't know me already. I'm Sheren Gaulbert, Vulval Pain Society Trustee, pain therapist, clinician coach, and pain science educator. Now, today we have a very, very special guest. It is so important to hear patient voices and patient experiences. And today we are so delighted to welcome. Hi, Harriet.
Hi, Sheren. How are you?
God, I'm very well, thank you, Harriet. I'm so delighted you're doing this. Harriet Reed is a resident doctor and also has a lived experience with vulval pain. So today, it's really, we want to hear about your journey, and we could dive in at any point and maybe end up with you now being a resident doctor. Maybe that, I don't know exactly what your timeline is like, but let's start off with what was going on in your life when vulval pain emerged, if you like, in your life.
Well,
what sort of
it was
age?
a bit I was 19. It was a bit of a slow burner, really. I'd had sort of sex for previous years, and I'd had no issues before. And then when I was 19, I was kind of 3 months into a new relationship, and I had like an episode of thrush and went to the GP, got that sorted, and it was fine. But sex was a bit tricky afterwards. Like, it just was a bit more painful, and I thought, oh, maybe I've had thrush. I'm just a bit sensitive down there. I'm sure it will improve. And then a few months later, I was still 19 at that point, I had thrush again. And I remember it just never got better after that. So that feeling of like burning and stinging and pain, it just never recovered after that thrush episode. And I just didn't understand what was going on at all. I'd never really heard much about kind of prolonged like pain during sex. You kind of knew about things like endometriosis and things like that. I was in second year of medical school at that point, but yeah, I still didn't really understand what was going on. So in that kind of first year, quite a lot happened. I couldn't really have penetrative sex at all. I remember like there was one instance, and my partner at the time was really kind of trying to understand and be supportive and things like that, and he'd taken me away for like a romantic weekend, and it was physically impossible. I just completely like closed up, I think emotionally and physically. And then I thought, I need to go to the GP about this, because like I can't.
Oh, Harriet, you've frozen.
Hello. Sorry.
Can you hear me? Harriet,
are
you there?
Has that come back?
Yes, you're back.
Hello. Sorry. Has that come back?
You were saying...
Okay, good. Hopefully the Wi-Fi lasts.
Yes, fingers crossed. Otherwise, I'll be filling in, and that is not the same. So you were saying that you finally to go to the GP. Tell me what then happened.
So I went to the GP, and I just said, I'm having difficulty with penetrative sex. And I just was really shocked by the response. And I think it was more probably ignorance than, not being compassionate. But basically the GP just turned around and was like, it's just kind of all in your head. It's like, why don't you just try having a glass of wine before and see how it goes? Or, try having a relaxing bath. And I was like, well, I mean, I can, but I'm not sure that's going to solve everything that's going on. Luckily, you know, my friends and family were super supportive, and I've always had really open relationships with them. I probably wouldn't be where I was in this journey without their support. But yeah, I kind of was speaking to my mum about it, and actually my mum had been through something similar and was like, just kind of saying to me, you've just got to be persistent, like you've got to keep trying, and you know, like researching and that kind of thing. And then I ended up like looking up more into it, and that was when I found the Vulval Pain Society like page, and it was just so enlightening. There was so much information on there, and there was patient stories, and I thought, okay, this isn't just me going through this, because that's really how I felt. I was like, I am the only person in the world that is having difficulty with sex. I think particularly as a young girl, there's been so much movement towards sex positivity, which is amazing, but often it revolves around good sex and positive aspects of sex. And actually, as a young woman at 20, I was so embarrassed to say that sex is not enjoyable and I don't want to have it, and it's bad. I felt like nobody else was going through that. I felt everybody else was kind of in their, you know, amazing sexual era where they're kind of trying new things and really enjoying it, and I just felt so alone. So yeah, I sort of found that, and I was like, okay, I've got to just like keep trying. You know, me and my partner made adjustments, like we just decided to take penetrative sex off the cards, but then unfortunately he didn't know that he had like suffered with cold sores at all, and in the process I ended up like contracting genital herpes via oral sex, which just made the whole pain situation a lot worse. And again, like something that I wasn't even, you know, I was second year into medical school, and I don't think I really understood at the time that herpes could be transmitted like that either. I was so shocked. You know, and obviously he felt horrendous. He'd never had a cold sore before. It was such an unlucky situation. So I was kind of having that, you know, as well as the thrush. And then I guess the third aspect was I've been having lots of tearing. And I did go and see like a gynecologist. You know, fortunately, I was really lucky to access kind of private healthcare. You know, it was just really fortunate. And she was really great. And she was like, you know, I think you have got vulvodynia, and I think you've got vaginismus probably as a result. But she said, but also your skin does look odd in your vulva. She was like, you know, it's tight and it's white. And with your history of tearing and itching, I'm going to refer you to a genital dermatologist. So I went to see her, and she then diagnosed me with lichen sclerosis. So I kind of had like the thrush, the herpes, and the lichen sclerosis all in 1 year. And as a result, the vulvodynia and vaginismus, you know, there'd been so many insults. I mean, whether it's a chicken or egg, it's difficult to know, but I think it all just accumulated in me really struggling with kind of sex at all.
Mm.
Yeah.
It's disappointing to hear that something I certainly heard. I mean, you're probably, I imagine, about half my age. I'm being generous off there. And I used to have vulval pain back in the 90s. And these are messages I certainly heard back then, you know, oh, just have a glass of wine, just have a bath, just relax. Oh, yeah, of course you can just relax. And it's disappointing to hear that those messages are still, you know, still prevalent. And we do know that it is that first hurdle, getting through. Now, some GPs, you know, will be knowledgeable or realize that a referral is required. But more often than not, there just needs to be pushing, keep on pushing. And I'm glad that you are talking to us today so that people may understand that actually this is common. Vulval pain is common. 1 in 7 vulva owners will experience vulval pain in their lifetime. It may not come with, you know, lichen sclerosis and, you know, genital herpes, but, you know, there will be a reason for what's going on, and an investigation is required, and then the ideal treatment plan. So for you, I wonder, You were talking about sex and penetrative sex and taking that off the table. And I think
Mhm.
this is quite an important message, isn't it?
Yeah,
Because we live in a time where you watch a TV show or a film and it's, oh my goodness, it's straight into
yeah,
penetration.
yeah.
Deal with that because you said, look, it was difficult where you thought all my friends are probably having fun and having a really good time and enjoying sex. How did you manage that time? And how did you then go to actually, we'll take penetration off the table?
Yeah, I mean, I think it was really difficult, because but I think again, as I said, I'm fortunate, one, that I'm quite an open person, and two, that my friends and family were supportive, because I was kind of kept saying, like, this isn't normal. And I was talking to my partner about it. And again, like, I think really having my mum be like, she didn't understand what had happened when she'd been through it, because it was, but she was like, I've had similar. And I said, okay, so it's not just me. And I think the more you talk about it, the more you realize that actually other people do struggle, but you have to talk about it a lot, because people don't want to say that sex is difficult, especially, now. But I think we were talking about that, and then it was really difficult on our relationship, and I think there were relationship difficulties which accumulate. Like, it's hard with a chicken or egg. Did the difficult sex create relationship difficulties, or were there relationship difficulties which contributed to difficult sex? Probably a bit of both. But one thing that I did say was, I was like, I think I'm just feeling so much pressure, and that's not helping. Every time I feel we are becoming intimate with each other, I think that it has to go all the way to penetration, and that's just stressing me out. And actually I enjoy being intimate in other ways, as do a lot of people, but as you say, it's such a perpetuated message that penetrative sex is the only form of sex, and that's something I've had to unlearn, I think. And even in my, like, current relationship, that's something I kind of brought in, and I was like, I don't want every you know intimacy event to lead to penetration. It doesn't have to. There's other ways to enjoy it, and I think when you take the pressure off of that, it does become easier, because of course there are psychological elements to the pain as well. And vaginismus is very much, for me anyway, like, it's very much a psychological thing of being like, I've had lots of pain down there, and I don't want it again. So making sure that I focus on kind of other aspects of sex is really important, but it is difficult,
Yeah.
especially because, again, a lot of I'm a heterosexual woman, so, like, I've only dated uh, straight men, and that is something that's just not really on their radar. They grow up with different expectations, and then coming in and kind of saying, I think it's really hard to feel like you're not emasculating someone, and being like, I don't like, I don't always want penetration, and actually, can we try other things? For them, it's kind of like, oh, well, I just thought that's what we do. You kiss, and then you have sex, and then that's kind of it. Like,
Isn't it lovely to just open up the possibilities of other things you can do within
yeah,
a relationship, or if you're having
yeah,
fun. Um, and if anyone's got Netflix, Principles of Pleasure is quite a good watch.
oh,
Um,
nice.
and book wise, so again, if you're watching this and you're listening to Harriet and thinking, right, how can I take penetration off the table? I would absolutely suggest this lovely book here. This might actually be, yeah, that's Mirror View, isn't it? It's Come As You Are, Come As You Are by Emily Nagoski. Um, and we have certainly done live streams on psychosexual health and sex intimacy whilst living with vulval pain. So those are things to explore coming out of this live stream, for people to go and have a look at. Um, what else do you think was really useful in your journey? Because once you had a diagnosis, you had three different things going on. How have you managed that journey?
I think it's been, for me, like, two separate journeys, one managing the physical and one managing the psychological. And with the physical, I obviously had I still have treatment for my lichen sclerosis. I started off with steroids. That actually, although it did reduce kind of some of the itching and some of the scarring, it actually made my tearing worse. And again, because I was fortunate to be like seeing private healthcare professionals at that point, I was actually put on topical tacrolimus, so like Protopic, which I think some people have for eczema, and that does cause burning initially, but it was much better. It caused much less fissuring, and that's what I still use now. But to be honest, I don't even need to use it regularly now. It's so much more settled. I only really use it when I notice that it's kind of flaring. So there was that. And then one of the things that the VPS was so good at for me was about like vulval care. And that's something that has been life-changing for me. I use like an emollient, although it did take me quite a while to find one that I liked. I use an emollient, like, you know, almost every day. And I'm really, you know, big on kind of like just trying to keep my underwear cotton, and like even finding kind of sexy underwear that has like cotton lining, like that kind of thing. Is really big. Just avoiding anything. I don't use any kind of wash or anything like that. And that was something that was really helpful going on the website and just being like, actually, there are small changes that you can make that can help. To be honest, one of the things at the time, I was so worried about the herpes, and it's been the least of my worries. I mean, it is HSV1, which tends to flare less than HSV2. But it's kind of been a bit of a non-issue for me, which really surprised me, because again, I think there's so much that's perpetuated about herpes being life-changing. And, you know, I do think obviously some people have it worse than others, but, you know, I have on repeat prescription acyclovir if I need it. So I kind of made sure I was managing all of that. And then really it was tackling the psychological aspect. I think it was really tricky in my relationship at the time. I just think we didn't quite ever match each other in terms of my needs. And I kind of wanted to suggest things which created a more positive association with sex, like, you know, because it was so difficult. I wasn't really having orgasms or anything like that. And I kind of suggested vibrators, and that wasn't kind of received that well. And I think it was difficult for my partner to feel that he also couldn't give me what I needed, if that makes sense. And I think that did lead to a bit of a breakdown. You know, it wasn't the reason that we split up or anything, but it kind of happened alongside that. I think with my current partner, he's so like loving and understanding, and you know, he anything that will help, he kind of sees as is positive. And I just really, I really wanted to try and create more positive associations with sex, you know, whatever form that was in, just making it a safe, fun, positive space. So taking penetration off, using vibrators, using lube, like using everything at my disposal to make it better. It was really helpful. And then I think one of the most transformative things was seeing a gynae physio, which I don't think many people have really seen, but again, my mum is fantastic. And there was basically at her local gym, a physio started who kind of specialised in postnatal care for women. And it was like targeted at people from the gym. But my mum had looked her up on Instagram and seen that she actually did some stuff for kind of pelvic pain and things like that. So my mum just walked up to her and was like, look, I don't know if this is something that you can help with, but this is what my daughter's going through. Like, would you be interested in seeing her? And I had like a multitude of sessions with her. And I think for me, it was just, you know, having somebody like, you know, it was she was putting her fingers in and that kind of thing, and having that in a really safe, non-sexual space, and just getting to grips, like relearning almost that this is okay, like this is not going to cause you harm, was really quite transformative for me mentally, and made such a big difference. And having, you know, I you know, we used to talk and stuff like that, and it was quite therapeutic in a lot of ways. And I also had I've had like previous operations, kind of 4 previous abdominal surgeries, and she actually did quite a lot of work with my scar tissue as well, and felt that was a bit linked and things. So it was just, I think really the holistic approach is what you need for it.
Yeah, absolutely. Holistic, multidisciplinary, and finding that mix or jigsaw of therapies that works for each person. That is the key, because one person may not work for another. But we do know, in terms of, vulval pain, in terms of persistent pain, we are talking biopsychosocial. These are intertwined all the time. And biopsychosocial seems to get a bad rap because people just hear, oh, so do you think it's all on my head? Absolutely not. We're talking it's biological. There's a psychological component and there's a social component, i.e., you not being able to talk about it with other people, maybe not feeling that connection within a relationship. All of these are intertwined, and the biology kind of encapsulates all of that. And certainly that building safety is such a key component, isn't it? Because ultimately, if you have experienced discomfort or pain, then that's remembered, right? You've got a pathway ready to fire off when anything is happening in that area, and it fires off, and there may be a little bit of adrenaline dripping into the system, some other inflammatory chemicals. And as soon as we go into that fight or flight, the first muscles that tense up in every human being are the pelvic floor muscles. Because guess what? If there's a predator coming at you, we don't need to have sex. That's not going to save our life from a tiger coming at you. So we clench up, the pelvic floor clenches up, the jaw clenches up. And so building that safety back into the body, whatever that looks like for each person, whether that's accessing psychological therapies, physio, finding that right mix is essential. So tell me, what do you think, out of all the things that you've come across, has made a difference? Is it a number of factors? So you've talked about, actually, Catherine in the background has put up probably the page you looked at, advice for daily life and the vulval care. People can have a look at. And actually, you were talking about emollients, so you will find that on that page. Catherine has popped that up on the Facebook page. And I'll pop it up on the YouTube page as well. And emollients, are you using it to wash the area? Are you using it I
usually use it after I've washed, mainly. So like once I've showered, it is difficult to like do it constantly. They do recommend more than I do, but realistically I manage like every time I shower, basically just like a moisturizer. I don't tend to, when I wash, I just use water. And yeah, that was definitely helpful, really helpful. I think it's really interesting what you said as well about like different things work for different people, because a couple of things, I feel like I should touch on a couple of things that didn't work for me that have worked for other people. I did try amitriptyline for about 6 months, and I know that does work for a lot of people, but actually it just didn't really work for me, which is one of the reasons why I thought, okay, I need to take a bit more of a holistic approach, because it's clearly not just neuropathic pain that can be targeted. There's other things, like my skin, and that really helped. And I think it was really the most important thing was really, as I said, kind of going back and relearning sex to be fun and positive and safe. I think, as you say, like my brain had just been completely rewired, because I'd done lots of things when at the start of my, we're talking over a 6-year journey here. So in like the first couple of years, I just kept trying to persist and push through. And all that was doing was just reinforcing that this is painful, this is horrible, this is not enjoyable. And I think it took a lot for me on a personal level to be like, actually, I need to prioritize myself and not just try and keep having sex with a partner because I feel that's what I owe them as a girlfriend. I think I really struggled with that, feeling that was my role as a girlfriend, was to be able to provide sex. And that wasn't a partner pressure, that was like an internalized view. And I think it took me kind of going like, actually, no, I have to put myself first. I don't want to spend the rest of my life having unenjoyable sex. So I'm going to have to take a step back, understand what's going on, and try and relearn everything from the beginning. And things like topical lidocaine, that's I still sometimes use that if that's another thing, because again, it just creates, you know, it's sometimes can ruin the moment a little bit if you're like, can I just put my lidocaine on? But what it does do is it creates a much more positive and enjoyable experience for me. And especially when I was at my worst, like that was another thing that, okay, well, if I can make this pain free, then I can have a bit more of a positive experience. And then that it gets better the more you do that.
Yeah. And all of that is building safety.
Yeah.
And those muscles relax, you feel better, and you have the opportunity to enjoy yourself.
Mm-hmm.
And because you have lichen sclerosis, I wonder, prior to all of this, did you yourself notice there was a change in your vulva? Because you noticed the white patches. Were you aware of that beforehand?
I wasn't particularly. I think I noticed it more after the herpes, because I was kind of looking at my vulva more. And I did notice that it was very, but it was very just white and like almost scarred. But I think in my head I thought, oh, maybe it's just scarring from the herpes. Because that was kind of when I'd noticed it. But the genital dermatologist was pretty sure that, you know, this was not just scarring, there was something else underlying that. But I guess, again, another difficult thing is that I think you just don't really see that many vulvas. They're not really like growing up. I just don't think they're, I think you can, see, I don't know, maybe that's unfair to say that you can see lots of different penises, but I feel like you kind of know what they look like and that kind of thing. Whereas there's so much variation in vulvas. And I know like friends that feel insecure and things like that. And I think it's, again, just because we're not really exposed to how different they can look. Even in things like porn and things like that, there's very like, I mean, I think most people, are chosen because they look a certain way anyway. But again, it's not that much focus really in it. There's not much focus on that. And I think that probably would have, again, been beneficial for me to just be a bit more comfortable looking, how many, I don't know, maybe it's more than I think, but I don't know how many women actually like get a mirror and look at it. But I think that's really important to see. And
yeah, please get familiar with your vulvas. Get that mirror out and regularly check it, because it just means that if there are any changes, you then spot that early on and go for help. So get familiar with that part of your body that is hidden much of the time.
yeah.
It's part of you, just as your mouth is part of you, just as your ears are part of you. It's your vulva. Check it out, get familiar with it, and if there are any changes, go and see your GP. There's a lovely, have you seen the Great Wall of Vulva?
I think I've heard of it, but I don't know if I've seen it.
So it's an installation. I think it's currently in the States somewhere. I'm going to put up website for it, because you can you can do a virtual visit, and it just has, it's a wall of vulvas. I think how many, 150 vulvas, I can't remember, quite a lot of vulvas, and the variety of vulvas that you see. And again, just for people to know, there's no right or wrong, or what it, just get familiar with what it is for you, what it looks like for you. I think this is Catherine in the background saying the difficulty with the vulva is that A, it's tricky to look at your own, and B, general education on the structures of the vulva is not what it should be. Absolutely agree. I mean, it's not easy, and yet, I mean, you can just get a handheld mirror and legs akin and have a look that way. But it's just finding a way, or prop yourself up on cushions or pillows. Find a way to do it. Absolutely. Totally agree. That I wonder, as you are a resident doctor, when you were studying medicine, how much time was devoted to the structures of the vulva?
I mean, in fairness, like there would have been an anatomy session on it. I think not enough is that and not enough on kind of like functions of the vulva and ways that it can be dysfunctional. I mean, there was, I only went to Cardiff, and I can only speak for Cardiff. That may be different in other medical schools, but there really wasn't enough teaching on that. And that was something that really, I was like, gosh, I'm like a medical student. I'm going to be a doctor, and I don't know half of this. This must be such a, as you say, like this 1 in 7 will at some point experience vulval pain. I mean, that must be such a common GP presentation. Why are we not being taught more about that? And I think it's particularly tricky because in the same way, I think there's still probably not a great focus on like the psychological aspects of male sexual dysfunction, but just in general, it's more well known. Erectile dysfunction, premature ejaculation, more of the general population kind of understand roughly what that is, and that can be a problem for men. And I think it really stuck with me that I was like, gosh, most of my healthcare professional friends wouldn't even know what vulvodynia and vaginismus is, let alone anyone in the general population. And how that, and again, that makes it really difficult to talk about, and it makes it difficult to talk to a partner about, and things like that. And I think I actually did look at doing, I still might do, it was something that I thought about doing, was maybe with the GP trainees that I work with, kind of giving them a survey about how much they know about vulvar pain, and seeing if I could do a quality improvement project and some teaching to maybe improve that, because I just think it's something that we need more teaching on.
Great idea. And let's stay in touch, because we can certainly help you in whatever way we can with that as well. So where are you now with things? Are things, I mean, we're about to reveal what you are doing for us, which is a lovely thing, but I'm assuming you are a lot better?
A lot better. And yeah, so I mean, not perfect. I think that's another thing that's really important to accept, is that actually it wasn't something that was going to have a cure. And that took a while for me to understand that this is probably going to be something that you manage for the rest of your life rather than you just get rid of. But I'm so much better. Everything accumulated all together, and I'm sure time makes a difference as well. But everything together, I now can very much enjoy penetrative sex with, occasionally it's difficult. There's certain things. A really interesting thing for me, again, something that I found difficult talking about, was that sometimes actually alcohol for me makes it a lot worse, because I have to use a lot of grounding techniques and that kind of thing. And I find that I don't get as much mind to vulva connection when I've had a drink. So actually saying why don't you just have a drink? I'm like, well, actually, I really don't enjoy that. It's not as good for me. And it's just learning everything. Making sure that I'm constantly managing the psychological, constantly managing the physical. I'm constantly having open discussions with my current partner. I think it's so important, about what's good and what's not. And yeah, we manage really, really well. And, I hope that is hopeful, because, it has taken me sort of 5-6 years, but I'm there now.
You're now here. Yeah, which is wonderful. And certainly, look, alcohol, that thing of, just have a glass of wine. Absolutely, alcohol actually may be a hindrance for some people. For some people, it might be caffeine, it may be certain foods, it may be high sugar. Again, everyone is an individual, and they have their own experiences of things. But one of the things we see is, people do dissociate because they're experiencing pain. And of course, if alcohol makes you lose that mind body or mind kind of vulva connection, then absolutely it can't be part of the equation at all. Kay is asking, oh yeah, good question. Please, can you give some examples of the grounding techniques that you use?
Oh, that's a great question, actually. Yeah, it was something I looked up, actually. Again, I'm such a researcher. I've read so many articles and things like that, and patient leaflets, and grounding is something that I find really helpful. And it's often, if I'm a bit dissociated or finding I'm kind of a bit more hypervigilant than I am when I'm really relaxed, I'll try and think of the 5 senses. So like touch, taste, feel, etc., smell. And like when I'm with my partner, I try and like consciously think about those things. So I'm like, oh, I love the way his aftershave smells today, or I don't know, I love the way his haircut is, or you know, I love the feel of his bicep. Like I really have to think, you know, those thoughts, and that sometimes makes me less hypervigilant, and I suddenly relax and I'm like, oh no, this is really enjoyable, I'm enjoying it because of these things. Or you know, I love the way that feels on my leg, or like, you know, something like that. But it's quite a conscious process. They're not kind of just thoughts that come into my head. I'm actively searching for them, like, what do I like about this? And I find that that's really helpful if on the days that I'm struggling, but I know that I do want it, it's just that physically I'm not quite there. That I find is really helpful.
And what you're doing is of course, you're moving from an internal focus of to an
Yes.
external focus. And anything that five senses, mindfulness is a lovely practice to do. But within that, you know, within an intimate situation, just using what you can see, what you can hear, what you can smell, and so you're having a sensory experience, but your focus isn't inward, it's out
Yes.
here. There's a lovely exteroceptive awareness. Kay says, oh, that's super interesting, I've never thought of that. Yeah, it's lovely. You know, we do this sort of thing, you know, if we you know, if you have a pet, you know, a cat or a dog, or you know, whatever your fluffy animal of choice may be, you know, really good at exteroception.
Yeah.
Right, we
Yeah.
are good kind of that tactile, we're looking at them, we can smell them, we see them, we
Yeah.
hear them. And I'm not calling your partner a pet, but
No, but it's true.
skills, these abilities we have just within a intimate relationship. That's all that's happening here, that you
Yeah.
have these. I'm just going to have a quick look. I think there was another comment here earlier on. I think it was from Kay. The old glass of wine, eh? Not good. So she says, I always felt it was the lack of sex that impeded relationships, but with time I realised that beautiful women were having sex and their relationships still ended or suffered. It's taken years to feel that it's not me. Thanks for
Yeah.
sharing. Okay,
That's
absolutely. Not you at all. So you are better, you are managing things better. And now on to the awesome news that you are about to do. Will you tell us what you're about to do?
Well, yeah, I'm running the Cardiff Half Marathon in just under 2 weeks. So yeah, it's amazing. It's something I always had in the back of my mind, when I genuinely thought to myself, like, when I'm through this, I want to do something to give back and to celebrate, I guess, as well, that like there is hope and, you know, at improvement. And it's a funny story, really, because when I was in my second year at uni, all of my best girlfriends who I was living with at the time all did the Cardiff Half, and I didn't, and I was just too scared. I was like, no, I don't want to do it, I'm not fit enough. And they have never let me lived it down, and neither has my dad and one of the girls' dads who also ran it. They've been on my back for the last 6 years to be like, come on, when are you doing this Cardiff Half? So I thought it was a perfect way of fundraising for the BPS.
Wonderful. And of course, we've got the details up here if you want to sponsor Harriet. What's happening with the funds, Harriet?
Oh, I mean, I just honestly, I can't express how grateful I am for how generous everyone's been. I really was in my head. I thought, wow, I'd be so proud if I got about £400, and we're nearly at £1,000, and I can't believe it. Everyone, you know, from my closest friends and family to anonymous donators, they've been so kind and generous, and I think it's been. I think really the most amazing, obviously the funds are fantastic, but the amazing thing is just the conversation that it started as well, and having lots of people, random people on my social media sort of message and reach out and say they've been through something similar but felt really alone. And that was really what this was all about for me, is that just like making sure that we're having these difficult conversations, and building awareness. And yeah, I think the funds have kind of followed that, which has been amazing.
Thank you so much for doing this, because yes, you're raising awareness and you're raising, funds for us as well at the Vulval Pain Society, and we're glad that in some way that we helped on your journey. So if you'd like to donate or sponsor Harriet, I should say, the code is there. You can just pick up your phone, use your camera app and tap on it and it will come up with it, or you could just pop this into put the link into your browser, and I'm putting it up as a comment as well, so you have it there. Thank you so much for doing this. Anything else you wanted to mention?
Is there anything else? I mean, thank you guys, honestly. It's a mutual grateful scenario here. Like, I'm really grateful to have had like a space online that I felt I could go to, and really truly made me feel like I was not the only person on the planet going through this. So, thank you for everyone at the Vulval Pain Society for providing really important information. I don't know. I feel like one of the things I wanted to mention was that I was actually I'm doing a pediatrics rotation at the moment, and
Right.
I was having a teaching session the other morning, and it was on breastfeeding and kind of talking all about that. And one of the pediatric registrars said something which really stuck with me, because I feel you can apply it to lots of things. But she said breastfeeding is natural, like walking, not breathing. It's so in terms of that, a lot of people, and this is the same goes for sex. I think sex is natural, like walking, not breathing. It's like you have to learn how to breastfeed. You have to learn how to have sex. It's not something that you just come out of the womb and you just start doing. And I think for me, like, I felt that I felt I was such a failure for not being able to do something that was so natural and so normal. Everyone else has managed to do this, but actually it's the same thing as kind of walking or running. You often need aids like good shoes and things like that. It's the same for sex. You need things like lube and foreplay, like, it's so important. And if there are insults, if you fracture your leg or your toes, that you have to relearn that. And if you have any insults on your vagina or your vulva, you're going to need to relearn. And I feel like that was it. She said it the other day, and I was like, oh gosh, that's such an important differentiation. This isn't just something that happens for everyone. Some people, it's fantastic, it's great, it's easy, and they don't have any problems. But a lot of people do have problems and need extra help. And I just thought that was like a nice sort of message to end on.
I like that. Not like breathing, but like walking.
Yeah.
And sometimes you need some aids. Yeah.
Exactly.
And where are you? So you're a resident doctor. Tell us more about what your day-to-day looks like now. Oh, Harriet's frozen. Are you there, Harriet? Okay, hopefully.
Sorry.
Harriet. Oh, you're back?
Just cut out there. I'm back.
Right.
I think that the one a bit temperamental.
Before we get onto your day-to-day, the question here, where is it? I know I just spotted it. I wanted to ask Harriet whether her vulval pain has had any practical implications in her life apart from sex.
I think it doesn't impact my life I wouldn't say in a significant way. I am kind of mindful about things like swimming and things like that with kind of chlorine, and I guess aspects like that, and certain things like cycling I don't love doing. But in terms of other practical implications, I don't really feel that it hinders my life in a lot of ways, which I think is really positive. It's just making sure, what you wear and what you do is conducive to kind of alleviating the pain rather than worsening. I think sometimes things, even just like wearing really thick jeans, and that can do it. But I would say overall it's quite minimal. I feel the biggest impact for me was probably in a sexual setting.
Yeah, and again, some people can swim and it's okay. Yeah. And a lot of people do get better with time. And that can be a factor. And then making sure we're looking after everything, that holistic approach, multidisciplinary, whatever that looks like for each individual person. Listen, we want to help more people who live with vulval pain, because, as I say, it is common, and not just the people who live with vulval pain, their partners, their family, and of course, healthcare practitioners. We need more education. We are a tiny team of just 4. And for anyone who doesn't know us, we have Dr. David Nuns, who is the founder of the Vulval Pain Society. He's a consultant gynecological surgeon, and he specialises in vulval pain. He's the clinical lead at Nottingham University Hospitals. Winston de Mello is my other fellow trustee. He's a former consultant in anaesthesia and pain medicine at Manchester University NHS Foundation Trust. He also specialises in vulval pain. Winston's working on a really important project, and there's something you touched on there, so we're going to be in touch. We'll keep updated, those of you listening or watching, on what Winston is up to once we're a little bit further forward with things. But we do a lot of work in the background that people don't necessarily see, and of course we've got leaflets and downloadable guides. We run these events, and getting information out to conferences or other events so that we have a presence there. All of this, of course, costs us money, and we are a charity. So there's David, Winston, there's me. Like I said, I'm a pain therapist. I specialise in vulval pain. I'm a clinician, coach, and pain science educator, and I have a past lived experience with pain. And Catherine, who's in the background there, doing her thing, she also has a lived experience with pain, and she keeps everything running smoothly in the office and so much more. When you look at our website, she is the woman who coded our website. She's immense. We are all volunteers, and that just means we can't necessarily reply as quickly as we'd like to emails or keep an eye on social media. And again, any small donations and sponsorship would mean that potentially we could look at hiring someone part-time to keep an eye on social media. It can also mean that it keeps us running, keeps our website up to date, keeps us running these events and getting out to more places in person and running educational events. So there's lots that this could be useful for. So thank you so much, Harriet. Right. We are so grateful. Is there anything else you wanted to mention before we wrap up?
I don't think so. Thank you, and thank you to all 4 of you for creating a charity and running a charity that's really, really important. So thank you guys, and thanks for having me.
Thank you so much, Harriet. It's been such a pleasure. And if you can keep talking about vulval pain, we'll certainly still keep talking about vulval pain, and knowing that it is common. So if you check your vulvas, right, if you're a vulva owner, go check your vulvas. Get familiar with it. It's part of your body. And if things don't feel right, go and chat to your GP and persist for answers and that referral. So you can re-watch this live stream if you missed any part of it on our Facebook page. We have all our past events on there. We also have an ever-growing playlist of nearing about 50 video replays and presentations on our YouTube channel, and we will pop those links up for you. And we have covered a lot. So I mentioned already, we've covered psychosexual medicine and intimacy with vulval pain, the relationship between sleep and pain, best practice in treating vulvodynia, multidisciplinary care or holistic care. Things like physiotherapy, absolutely. We've covered physiotherapy several times with different experts. Vulval skin conditions such as lichen sclerosis, pain science, calming the nervous system. So yes, we've covered that. That's me. Supported self-management of pain, preparing well for appointments. So if you feel like you're not being heard, you may go to our website, and we've got a form on there for you to sort of prepare really well and represent yourself, when you go to an appointment, and really kind of prepare for that. And then menopause, the other end from where you are at the moment, Harriet. Yeah. Pudendal neuralgia, so much more that we've covered. Listen, thank you so much for watching. And if whether you're watching the replay or you're watching it live, please share videos and posts far and wide with anyone you think can benefit or needs to hear. We are on YouTube, on Facebook. We're sort of on Twitter X, but we are on Insta. On Instagram. So listen, thank you to everyone who is already sharing our posts and liking our posts and getting the word out there. We're really, really grateful because you're helping us help other people even better, helping people with vulval pain even better, helping the healthcare professionals, clinicians treating with people who live with vulval pain even better. And of course, check out our resources. vulvalpainsociety.org.uk. The final slide that we will put up when we both exit the studio will have Harriet's link to donate or sponsor Harriet, and also the details of our social media and our website. So that is all from us today. Thank you again to the wonderful Harriet Reed.
Thank you so much, honestly.
Thank you so much. And thank you all for being with us live or on the replay. Bye for now and keep in touch. We will see you next time.